Yeah. Run strong, stay injury free. The ultimate guide to injury prevention for runners. Welcome to the Run for PRs podcast, a dedicated podcast helping runners of all levels stay strong, run efficiently, and avoid common pitfalls. I'm your host, Victoria Philippi, and today we're diving into one of the most crucial topics for all runners, injury prevention. If you've ever dealt with nagging pain, an unexpected setback, or a full-blown injury that sidelined you from your training, you know just how frustrating this can be. But if you can reduce your risk of injury and keep running pain-free, stick around because today we're going to break down practical strategies to help you stay on track and stay injury-free. In the first segment, we're going to be talking about understanding some of the common running injuries. So before we talk about injury prevention, it's good to maybe brush up on some of the really common ones. And then also I think it's really good to talk about going in before you feel like something is completely preventing you from running. So I know oftentimes people are afraid that if they go in for something before it's like a full-blown injury, that maybe the doctor will tell them to stop running, or maybe there isn't really a treatment plan that can be had when you're not in like full-blown pain. But oftentimes finding a sports PT, physical therapist in your area that specializes with working with athletes, they can help you come up with a plan for getting your body strong and correcting any imbalances that are there. So you really want to go in if you're noticing, hey, my hamstring after doing speed workouts, I have this like lingering pain for a day or two, but then it goes away. Typically speaking, those are those first couple signs that something could down the road lead to an injury. And so we really want to be listening to our body, keeping a log, keeping a journal, seeing what these little flare-ups are along the way. And if something we see happening maybe after every speed workout, or maybe it just happens pretty regularly, that is something that I would recommend everyone go in and get checked out with a sports PT so that you can address what that weakness is before it completely sidelines you. I think there's a lot of people out there who just kind of power through things until it gets to a point where they literally physically cannot run or cannot walk. And so we want to be all about on that prevention side of things. We want to go in before something is so chronic that you physically cannot walk or get through a run.
Right, that's very well said. You know what? In the early stages of most of these injuries that we're going to talk about, it is possible to still run through them with proper treatment, strength training, and just with reducing overall volume or intensities, right? So kicking it off, the first one I think that comes to mind is like runner's knee. It seems like it's a pretty common thought, knee issues where people have just soreness around the knee or behind the kneecap. And that's generally due to overuse, or just if they're new to running, maybe it's poor biomechanics, maybe they're not in the right shoe. Some of the other ones that come to mind are shin splints, inflammation of the muscles and tendons around that shin, or the tibia-fibula bones, that tibialis anterior muscle that runs down from the knee down to the ankle. So that's kind of a very common one. That can be on the inside too, and that's really when it's tricky to manage, especially if it's tucked in right along the bone. That can be quite painful. When I was working with high school athletes, we had a lot of kids that had this flare up early in the season just because they go from like not running at all to running, and so it comes with increasing that mileage too quickly.
Shin splints so common, right? And when I was in high school and I first started running, I got shin splints and I was told not to run anymore. And so one of those injuries, I think shin splints and plantar fasciitis, and even runner's knee, I think these are sometimes ones where people think it's just like this chronic thing they have to live with. And I would say that it's definitely not normal to have these things flare up. There are treatment plans available where you can completely eliminate all symptoms. I had plantar fasciitis back in 2020 when I was coming back postpartum from my middle child, and it was excruciatingly painful. I went in within like a month of things flaring up, and the first person that I went to wasn't really helpful. And so sometimes it takes going to multiple different PTs and getting different treatment modalities. Like if something's not working, definitely move on to someone else that can help you. And even when I told that person, hey, this isn't working, they actually recommended going to see someone else. So you can always see someone else, and make sure that we are our own biggest health advocates, right? So sometimes when we go in and we're not getting the answers or the treatment plan that we think we should, you have to be your own biggest health advocate. So go to see someone else, get a second opinion, see if you can get other treatment plans. And even with a plantar fasciitis or shin splints, I think what's tricky about those ones is once you kind of get them, it can be really hard to eliminate it with just rest alone. And I have been told multiple times that from different doctors that you actually won't get better with rest alone with plantar fasciitis. That's just kind of how it goes. So there are treatment plans. I think shockwave therapy is what helped. Doing a lot of strengthening exercises in my foot. And it was really interesting getting a whole foot analysis done of the biomechanics of how my feet are moving when I'm running and walking. He did that on me and told me, hey, you actually have a little bit of pre-arthritis in your big toe. And so that can be really frightening to hear, like, oh my gosh, how did she ever, get to a place of running pain-free? I just followed everything that he told me to do. I did these foot strengthening exercises 3 times a day religiously for several months. I had orthotics in my shoes. And then I did the shockwave therapy that he recommended. And within a couple of months, I never felt the pain again, and it's been something that hasn't reoccurred, and it's been 5 years, right? And in that time, I was able to run that sub 3-hour marathon, take 20 plus minutes off my marathon time, and all of those good things. So I think the biggest thing is being your own advocate, going in before things are chronic. The other thing is don't self-diagnose. So with shin splints, I have seen this happen in the running community a few times where someone self-diagnoses and they say, oh, I got shin splints, and it ended up being a stress reaction or stress fracture. And so we really want to make sure that we know what we're dealing with here. And so going in to get that diagnosis and get the imaging done is definitely better than just kind of self-diagnosing. So as we were talking about these injuries, yes, they are common, but that doesn't mean that you can diagnose yourself with what these injuries are, because there are pretty big ramifications for someone if they are running on a bone-related injury that can cause pretty severe damage, and you don't want to be running on something that's a bone-related injury, a fracture, making things worse. So make sure you're getting the proper imaging and the proper diagnosis for any of your running-related injuries.
Yeah, that's really well said. And some of these are tricky, like Achilles tendonitis, for example. I had that back in 2016, and it lingered for about 9 months. And yeah, I ran 2 marathons during that time, and there was periods where it hurt. The worst it hurt was getting out of bed in the morning. And so, it actually felt better after I got a mile or 2 into my run. And I've heard people with plantar fasciitis sort of have a similar experience with that. If it's in the milder stages, it typically doesn't hurt worse when you run on it. It's always later on when the pain kind of creeps up on you. So it's like later in the day or middle of the night or when you wake up in the morning. And so very important to kind of be aware of, which ones you can continue training through, but also knowing how to, incorporate things like you mentioned, foot drills, some strengthening, maybe calf exercises if it's Achilles, getting that soleus, getting the gastroc fired. And then just kind of some other ones here that we didn't touch on yet. IT band syndrome is very common, especially for new runners. This was actually the first injury I ever had that caused me to miss a race. It was freshman year in college. I missed the first cross-country meet of the year, and it was basically because we went to camp and we ran 3 times a day for a period of 4 days. And my IT band was just so inflamed after that. I had such sharp knee pain. So I needed to get it worked on by a guy who I've been seeing for ever since then. Active release therapy, really good treatment for IT band. Basically, it's an assisted stretch, but it's very, very helpful for that type of injury. And that can bother you in the knee and also all the way up the thigh into the hip. And so that one, again, could affect people differently. And then one last injury I put on you that I thought was kind of overlooked sometimes, because this one could take you out for a long period of time, in addition to stress fractures or stress reactions, is muscle strains or muscle tears. And so this is one where I've actually had several of them over the years in both calves, and it's extremely painful. You instantly have to stop running, and it hurts to walk. And so if you've gotten one, you probably know what I'm talking about. But there are different degrees of tears, and so over the years I've learned like, okay, what are the warning signs that this is maybe potentially going to happen again? But it's essentially the muscle just seizing up completely, and you almost fall to the ground. So extremely painful. You want to avoid those at all costs because it will take several weeks, if not months, to rehab and strengthen that muscle and get it back to being able to handle, running on it.
Yeah, that's really intense. And I've heard of other people on social media. We have a large social media following, so I get a lot of messages from people, and I've heard of people just going out and tearing like their hamstring and having to get a reconstruction surgery. And that always scares me because you always think, oh, you hear something happen to someone else, and then you assume it's gonna, maybe potentially could happen to you. But I think it's pretty rare to have like a hamstring tear in a distance runner unless you're really doing something pretty aggressive. There's, like you said, there's different levels of tears. So a tear where you would have to go get surgery, that's so severe. Whereas, there could be like a minor strain, that sort of thing, a little bit more common and can definitely occur in runners. A few things I thought were interesting that you mentioned, the IT band syndrome. I think that one's interesting because I did have that about 11 years ago, and it presented as knee pain. And so I thought I was just having like this knee issue. My knees were wrecked. And so until I went into a doctor and got that diagnosis of, oh, this is IT band syndrome, and the treatment for that was pretty quick and easy, but for a very long time I didn't go into the doctor because I was afraid, because you have this fear of the pain and you don't want it to do all of these things, and I was very young at the time. But moral of the story, getting that diagnosis actually can give you that peace of mind, and it can help you to realize what's going on within your body, and then maybe even becoming more aware in the future, things that are flaring it up, or you learn and you grow from all of these experiences. And I think I'm at a place where now I can kind of sense if my body needs a little bit of extra rest. But going back to the very beginning, you were mentioning in college that you ran 3 times a day for a camp. And so sometimes I think people don't realize what overtraining can look like. They think that it'll be so obvious to them, because it sounds like overtraining. Of course, you're not going to overdo it. Like when you overeat, you kind of know that you're overeating, right? You get full, your body's sending you signals. When you overtrain, it can be a gradual thing, and you can really, as a distance runner, push past, like that's what we do as runners. We push past our comfort zone, and we can have this really skewed perspective of how hard is it okay to push. And so we don't want to get into that mindset of pushing through this type of pain. And so it might just take a little bit of time to have an athlete really realize like what are okay things to push through and what are things that are, hey, this is, injury related. And over time, I think you get better at realizing what potential overtraining could look like. And we often see it when you're ramping up mileage too fast, maybe doing too many runs per week. So you might be running 20 miles a week, and that's presented in 5 different runs. But if you decided next week you're just going to run 20 miles a week, but you're going to run 1 mile every day really fast, you're still changing a variable there. You're changing the intensity, and you're changing how frequent you're doing it. And so anytime you're changing variables, that is a way that you could potentially have something flare up. Even when I was training for the Ironman last year, I went from running 60 miles a week to running 20 miles a week. And then I figured, biking is not really that intense. Like there's probably not a huge risk of injury going onto the bike, right? But I had a little bit of a quad flare up situation. It didn't prevent me from finishing my race or biking or anything like that, but it does go to show that, hey, you do need to kind of respect all sports, right? So even if you are injured and you go to bike every single day, you might actually aggravate a different injury, or you might cause even more pain. I think sometimes when runners have an injury, they're like, I'm going to go hard on the cross training. And it's like, well, that might not be the best thing for it, because you're utilizing a lot of the same muscles, but you also aren't used to biking. And so you could, even if you have a great running background, you can have like a biking related injury
sure
if you ramp it up too quickly. So I think the biggest thing is learning how to listen to your body and then just being aware of the signs of overtraining. So we're going to be talking about the key strategies for injury prevention in this next segment of the podcast. Now that we know what we're trying to avoid these flare-ups over time, let's talk about how to prevent these injuries from happening in the first place. And so when it comes to the bone-related injuries, I think that's a whole different, almost like subset of injuries. Of course, these things play a role, but I often find that people I know in the running community who have had bone-related injuries, we really want to be doing a deep dive looking at your blood panels and looking at your background, right? Sometimes even getting a bone density scan. I had a friend who several years ago, a very competitive marathoner, she got multiple stress fractures every single year. They did some of the blood panels to test her vitamin levels, and things were a little bit low with vitamin D and whatnot, which can cause some of those bone-related injuries. But eventually she got a DEXA scan, which essentially scans to see how strong are your bones. And she was in her late 20s, and they said her bone density was similar to someone who was in their late 60s. And so she was diagnosed with like pre-osteoarthritis, which is really extreme, right? And so we really want to be making sure that we're working with the right professional. So in that case, really she needed to work with a nutritionist. There were some other things going on with the loss of a menstrual cycle, and a lot of those things go hand in hand. And these are some of the conversations within the running community that we're having a little bit more frequently now. We do know that with running, there is that higher chance of those eating disorders and other issues that pop up with competitive running. And so just putting that out there, if you're someone that is maybe thinking that you're in that camp, definitely seek out professionals. There's a lot of registered dietitians who work in the space who would be happy to help you. And you can go from where you are now to being at a healthy place with your bone density can increase. It can get better. And so this individual, she went on to change a little bit of the way she was training, and working with a dietitian was able to get her menstrual cycle back, get to a place where she wasn't getting repeated stress fractures, and then her bone density did increase to a place where it was more in that healthy range. And so you can really change from where you're at now. So if that's where you're at, just know that with the right treatment plan and with the help and support of others, you can get to a different place. Now, if it's like a one-off thing, oftentimes I like people to, hey, let's look back, let's see, like, what did we do, right? So I think there was one individual that I went to college with who she fractured her femur. And so when it's a femur, I'm like, wow, that's one of the biggest bones in your body. To fracture that, that's a lot, right? You got to be, there's something going on there. And so taking a deep dive, looking back, what happened? There's usually a reason behind a bone-related injury. And in that case, she didn't really train at all during the summer. So she took 3 months of zero running. And then when she went to the camp that you were explaining, she didn't tell the coach. She just said, yeah, I've been training, and just went right back on into it. And within a couple of weeks, it was like limping and then getting the imaging, and boom, stress fracture. So these things do happen, and a lot of people think, it won't happen to me or I'm invincible, but you really do have to have a solid base when you go into any training cycle. And that's going to be probably your number one factor when it comes to, outside of the nutrition and the eating disorder realm, when it comes to a lot of these bone-related injuries. A lot of it's that like volume increase that can cause some of these to really flare up, and then along with intensity as well.
Yeah, definitely following like the 10% rule when you start increasing your weekly mileage. And I think a lot of the mistakes people make is they up the mileage and the intensity of their workouts at the same time. And so you might be able to get away with it for a little while, but down the road, that's kind of when things flare up. And then too, I have some athletes who, maybe they're training for a marathon, and so you don't want to sacrifice your training, but you're also sort of nursing something that's sort of minor. And if if you're not smart about it, that can flare up, and then it can prevent you from even getting to the start line for your race. And so there's a lot of factors, but yeah, following the amount of training, the training load, I think that's probably the number one thing. And then obviously you could always reduce mileage and really prioritize strength training. I think we're seeing more and more athletes, advocate for strength training now, and the stronger you are, the more resilient your body's going to be. And so, I've learned over the years too to avoid certain injuries that I'm susceptible to, like calf strains. I need to be working on my glutes and hamstrings and calves. I basically have to do the same set of exercises every time I'm at the gym just to make sure everything is firing the way I want it to and feeling good, because I've noticed warning signs, like little sensations in my calves or tightness around the ankles. And typically if I'm starting to get that, I know that it's time to reprioritize strength training or roll out my calves really good, get back to the gym, that sort of thing.
Definitely, strength training has become a lot more popular, I think, among the running community in the last decade or so. And it can definitely help you with that injury prevention side of things, because a strong body is a resilient body. You can focus on strengthening your core, glutes, legs. You want to really improve that stability and running efficiency. And when you're strong, all of your muscles are really firing. Sometimes what I find is if you have that like a weakness, right, it can like recruit different muscles, or maybe one of your legs has to work a little harder. I had a DEXA scan once, and it also showed your muscle composition on basically each of the major parts of your body, and your left versus your right. And I was really surprised to see that the right side of my body had, I think, 3 more pounds of muscle on it than the left side. And so, the guy who was kind of giving me the review was like, you're kind of borderline, where I would say you should probably do some of these like one-legged left side strength, because when you start to get more than whatever the percentage was of strength on one leg, it can create imbalances. And honestly, I wouldn't know that. Looking at me in the mirror, you cannot tell that. And you also can't tell it when you're doing a full, like a squat or a deadlift. I don't feel like, I'm using my right side of my body more, but I must be, right? And so really working on your weaknesses and trying to have a strong all-around body is key, especially for staying healthy. And I've heard the quote before, sometimes you have to train just to be able to train. And so that's what I think of strength training as. Strength training doesn't directly, increase your VO2 max, but it allows you to be able to train more and to train for longer, be more consistent, which in turn can allow you to be that stronger runner in the long term and increase your aerobic system, all of those things. The next way sometimes I see people get injured is that proper warm up and cool down. We want to do some of those dynamic stretches, the leg swings, high knees, all of the things to get your body warmed up and primed for running. The last thing you want to do is be sitting at a desk for 8 hours straight with minimal breaks. It be 5 o'clock in the afternoon, you have 500 steps for the day, and you just go out and you go hard on the hardest mile that you've done. And I know people do this. This is a real thing that exists. Maybe not people who listen to this podcast, but you really do want to do a proper warm up and cool down, especially if you're coming from a place of inactivity, right? So if you've been really active that morning, you're chasing kids around, you went to the park, you walked your dog, all of those things, the warm up, you already kind of warmed up, your body is warm and prime. But if you're going from doing absolutely nothing, so you've been sitting at a desk for 9 hours, you have 500 steps for the day, you're really going to want to do a warm up to help your body and your muscles prepare for the run. And sometimes people will say, I'm using the first mile as a warm up. And yes, you should do that as well. So start your run slow, but still try to get some movement going, because running is aggressive, right? So we want to make sure our body is warmed up and primed for it. And then investing in the right shoes, getting fitted in running shoes that match your gait, and then making sure we're replacing them every couple 100 miles, right? So everyone has a different preference with that. I have some running friends where I show up for a run, they got holes in their shoes. I mean, they're running them down to the core. I have also seen myself accidentally run all the way down to the sole of the shoe, right? So take a look at the bottoms of your shoes. Just make sure you're replacing them at appropriate intervals. I've heard people on the internet talk about how the carbon-plated shoes can cause injuries. I just want to put my 2 cents out there. I don't really think that shoes cause injuries. I think most of the time it's training related. So maybe if you're running carbon-plated shoes, maybe you're just tempted to run faster, and maybe you're running at an appropriate pace as maybe you're also doing other things. So while yes, they are a little bit harder on your feet in some ways, I don't think that certain shoes necessarily cause injury. I do think if you invest in the right shoes, it can definitely help you make sure you're getting fitted correctly and making sure that you're not running your shoes all the way down, because that can sometimes cause flare-ups.
Yeah, for sure. And the um, the next thing is the cross training and rest days. So when we think about how we're structuring our our weekly schedule, it kind of goes back to that 10% rule, right? Like making sure we are supporting our training with adequate recovery. And one way, if you want to increase your aerobic foundation without increasing your risk for getting injured, let's say you're somewhat injury prone, and so your sweet spot's maybe like 30 miles a week, but you have time and you're motivated and you'd love to be running 40 or 50, you just aren't sure you can get there, you could be adding in cross training. And so activities like swimming, biking, elliptical, there's a lot of great activities out there. There's the rower now, the skier, so there's a lot of options for that. And you can still get quality minutes in on those machines. And then
yeah, it's really important to also be aware that as you age, right, in the sport or lifestyle changes, I know coming back postpartum with each child, it's like I had to reevaluate what is my mileage sweet spot. So just because you have a history in the sport and that you have thrived off of 50 miles a week or higher before doesn't necessarily mean that's how it's going to be for the entirety of your running career. You want to really reevaluate in every year, right? Every season, is this mileage working for me? And if you need to reduce and kind of explore what that looks like, maybe that will be beneficial to you. And there can be a number of reasons why you add in cross training, but it can be really useful. So definitely use that as a tool, and maybe you'll get into something like a triathlon too once you start incorporating some of those other cross training activities like swimming, cycling, all those things. But also the importance of a rest day, right? It's really important to rest your body. If you're newer to the sport of running, I think running every other day is a really good option. You don't want to be overdoing it in terms of volume and ramping up too quickly. That is the biggest thing. I think volume is huge. You also don't want to be running too many fast miles, right? So following that 20% rule. So what is the 20% rule? So if you are, let's say you're dedicating 5 hours a week to exercise, aerobic exercise, 5 hours, you're doing maybe an hour 5 days a week. You should only have 1 hour total of all of that be at a harder effort. So maybe 2 of those 5 days, you're going to do 30 minutes of work each, right? And so you're going to have a warm up and cool down, maybe 15-minute warm up, 15-minute cool down, like a 30-minute tempo, 15-minute warm up, and then 5 by 6-minute tempo with recovering between, and that's it, right? So you don't want to be overdoing it in terms of the fast mileage, because I think that is really intense on your body. Also, listen to your body. Pain is your body's way of telling you that something might be wrong, so don't push through all the time. Make sure you address it before it turns into something bigger. And so just in summary, prioritizing that gradual progression in training is so key. And oftentimes, like, we don't see it ourselves. Sometimes having that outside perspective is really important. I know there's been a lot of times in my own running history, maybe 12, 15 years ago, where I had outsiders say, hey, whoa, you're overdoing it, you're ramping up. And I thought I was actually doing a really good job of managing my stress variables. And I think that unless you've trained a lot of individuals and you have a lot of experience working with different people, different training plans, seeing what happens when people do certain things, it can be really hard to know if what you are doing is going to be effective or if it's kind of risky, right? And so if a coach has had a lot of experience seeing how different things play out over time, they can really help advise you to, hey, what you're doing is a little bit more risky, and a really good coach is going to help you manage the risk, right? So there's always a risk versus reward to everything that we're doing within the sport of running, and I think coaching is all about that risk management. And so I like to talk to my athletes of like, yes, you can do this marathon. You haven't ran at all in the last 2 years, and the race is in 12 weeks. We know this is going to be very risky. What are your goals? So managing expectations, and then also evaluating, like, what is the risk? Are you willing to risk a potential injury, a potential having a setback, not having this really be a super great time training and experience? We can go after it, but you really need to make sure that your expectations are in alignment with reality for sure. And so incorporating strength training is also key. Make sure you're working on that stability. All of those things are really important, and they help you build a very strong foundation for avoiding injury.
Yeah, I'd say, you need to look at strength training and all of those little variables that we talked about, like PT work, um, rest, recovery, sleep. That's so important. You can't just focus on the running because
Right.
eventually things will start to flare up. And as far as like progressing through your training, like you want to look at that on a day-to-day basis. So, as you ease into every run, you should think about progressing your effort. And then as you progress your mileage, it should be gradual. It should never just be like where you go out and hammer, because then you're more likely to experience a setback, or you could get sick. Your body may take longer to recover, and so everything with running should be gradual. And you want to ease into, every single workout, every race, and that's really why sometimes in workouts we don't feel that great on the first rep, right? It takes maybe 2-3 reps, and then we really get in the zone, and it feels good. So keep that in mind. I think having the right gear can also help complement and aid you in that mindset, and that's why I always tell athletes, like, don't warm up in the shoes you're going to race in. Like, warm up in your slow shoes, and then you can do some dynamic drills, and then you can put on your fast shoes. And I think that just helps with mentally kind of preparing to start slow, finish fast, that sort of thing.
Definitely. Yes. A lot of really good points. And also, it doesn't necessarily have to be an injury, right? Some people, they can pretty much do anything and not get injured. I see it often, but sometimes it plays out in other ways, right? Like maybe it's going to be a burnout. Maybe you're going to get sick a lot. And I think these are other things that will occur if you don't follow that progressive approach and you're not prioritizing the rest and you're not doing all the little things. Your body eventually is going to ask for a break. And it might force you to take one by, hey, we're going to just really burn out here. We're going to catch every cold that exists to mankind over the course of the next 6 months. And so oftentimes our body is trying to tell us something. And so we want to use that wise mind and listen and try to see if we can work with our body and give it what it's asking for. Sometimes it's asking for more rest, and oftentimes I find runners are a little bit hesitant to give it more rest. Oftentimes runners are those type A's, they want to push themselves, but if you lean into that additional rest, you might actually find that you have a little bit of a breakthrough and that you feel a lot better in the long term. So you really want to look at what are my goals long term, right? With this podcast, I think it goes hand in hand with, hey, am I going to be a runner for a lifetime, or do I just want this to be like one season? I just want to check this off my bucket list and never do it again. I think if you just want to check it off your bucket list and never do it again, maybe you don't really care as much about these things. I mean, you look at players like in the NFL, right? They're okay with getting hurt because it's like they're making millions of dollars, and sometimes they just are like, whatever, I'll do whatever, right? So it's a little bit different. But when you're a recreational runner and this is more of like a hobby for you, and you want to be able to do it for a really long time, you might have a different mindset that you need to approach things with, of taking things a little bit more cautiously and not taking on all these additional risks and fighting through things, because it's not your career. Your career doesn't depend on it. You're not making millions doing this. And keeping those things in perspective, I think, is really important, just to kind of take that bird's eye view, take that step back that you need to add in that extra rest and recovery. I always like to err on the side of caution. If anything is feeling a little bit extra sore, even if I'm sore from lifting or something, I'll just move a workout, right? And sometimes as you get older, or maybe you just have a little bit more stress going on in your life, you might want to space out your workouts a little bit more. So maybe instead of doing workouts every other day or every 2 days or every 3 days, maybe you're just doing one a week, right? And sometimes those minor changes that you make can go a long way with having you become more of a lifelong runner and not constantly riding on that injury recovery merry-go-round hamster wheel that you feel like you can't get off of. So again, running should be enjoyable and sustainable. By following these tips, you can run stronger, stay injury-free, and continue doing what you love for years to come. If you find this episode helpful, don't forget to subscribe, leave a review, and share it with fellow runners. Also, if you have any injury prevention tips or questions, reach out on Instagram at Run4PRs, or you can visit our website, www.run4prs.com. Until next time, keep running and stay injury-free.